Maggie Smith says she's been dealing with typical cold symptoms, so she recently got a coronavirus test at Milwaukee's Southside Health Center. But it isn't just coronavirus Maggie's worried about, as variants are now believed to be more dominant in Wisconsin than the original strain of COVID-19.
I feel like I haven't heard necessarily of anyone getting the variants, but I know they're out there.
Since variants are considered to be more contagious and can cause more severe symptoms, Maggie's mother, Jenny, thinks everyone who tests positive for the virus should be able to find out whether they have it.
The question has come to my mind is, okay, then do people actually know they have that? Because that's kind of a big deal.
Dr. Alana Sturkle oversees the Communicable Disease Division at the Wisconsin State Laboratory of Hygiene. It's the largest of 4 labs in Wisconsin that have the training and equipment to test for virus mutations. Dr. Sturkle says labs are not allowed to inform the patient or their healthcare provider if they have a coronavirus variant.
Unfortunately, we have some really strict limitations. Federal regulations really mandate what kind of results can be reported back to patients from what kinds of tests.
Dr. Sturkle says labs conduct what's called whole genome sequencing on samples of positive coronavirus tests for surveillance purposes. That way, they can provide state and local public health officials a big picture analysis of how many variants are spreading in Wisconsin and where.
And that's where you're trying to identify which letters. It's like reading a book of finding A, T, C's, and G's to find out what that code is.
Given the state's limited variant testing abilities, Dr. Sturkle says they're taking a couple different approaches to get a full scope of the spread in Wisconsin. About 10% of the samples sent to labs are coming from all over the state to provide a geographical representation. The rest come from positive cases with unique circumstances.
So people who have traveled to areas where these are present, vaccine failure infections, breakthrough infections, reinfections, things that might indicate that there's a new mutant that we need to discover.
Dr. Sturkle says each sample that's sent to her lab takes 2 to 4 weeks to process from start to finish due to a highly complex process. The State Laboratory of Hygiene currently has capacity to provide results for about 400 variant tests a week. Is it fair to say that a majority of coronavirus cases now are a variant case?
We're just crossing that 50% threshold.
State Health Department data shows all 4 of the main variants of concern are in Wisconsin, and they make up more than a third of all samples tested from the southeastern portion of the state. Dr. Sturkle says the latest set of statewide variant data shows the B.1.1.7 variant that originated in the United Kingdom was found in 35% of samples they tested, steadily increasing over the past several weeks. The data also shows 2 strains that were first found in California, called B.427 and 429, are also becoming more prevalent in Wisconsin. They have been found in more than 10% of samples sent to variant labs in the past month.
It's not really something that an individual person needs to worry about.
Dr. Tito Izzard says no matter if people with coronavirus have a variant case or not, it doesn't have an impact on the guidance you'll receive from your doctor or health department, including the required time in quarantine.
Because it won't change their prevention strategy or their treatment strategy.
The state of Wisconsin currently has about 600 confirmed variant cases, but health leaders say that's merely a fraction of how many there truly are. Just a few months ago, these labs were testing about 1% of positive samples for variants. That's up to about 6% now. Reporting in Milwaukee, Ben Jordan, TMJ4 News.
All right, thanks, Ben.